Hi, I'm Victoria Dunkle with AdventHealth. We've had several people asking questions. They're concerned about whether or not it's safe to come back for emergency care. Well, I'm going to show you all the steps we're taking to keep you safe. It's one of our promises and we are fulfilling it through several steps. Let's go in and see what will happen if you have an emergency need. First, you're going to come into our emergency entrance this way. And what you'll find is a team member waiting to ask you some questions.
So start off by giving you a mask.
Okay.
Hand that to you. I'm going to grab your temperature real quick.
Okay.
And I'll be asking you some screening questions.
Okay.
I can be placing this across your forehead, down by your neck. Very good. You're 97.7.
Thank you.
Very well. Let's see what's going on today. Any difficulty breathing, shortness of breath, fevers, chills?
No.
Any international travel or a cruise line recently?
No.
Okay. Have you had close contact with anyone that's had COVID-19?
No.
Have you been tested for COVID-19 in the last 14 days?
No, sir.
Okay, very good. All right, well, if you come over here to registration, we'll get you started, okay?
Thank you.
And these folks will help you out from here, okay?
Okay, thank you so much.
You're welcome.
So our register team will get you started, and then they'll have you come over here and sit in one of our 2 designated waiting areas. We have 2 areas, one if you're experiencing COVID-19 symptoms and one if you're not. As you can see, we've placed chairs 6 feet apart for your social distancing safety. If you're experiencing COVID-19 symptoms, we're going to ask you to wait in this area. As you can see, we've cordoned it off with curtains. We have our chairs 6 feet apart, and this area is designated for people experiencing those specific symptoms. If you're here for a non-COVID emergency, once you register, a triage nurse will come and call you in to be checked out and to start the process of your care. This is Maria. Hi.
Hi.
So what will happen?
All right, well, let's start and get some vital signs and we can chat a little bit about what's going on today.
Great.
You can just relax that arm.
Maria, I noticed you arrived with a mask already on and you're wearing gloves.
Yes, so we are asking that all staff and all visitors wear a mask. It's for your protection, but also for mine.
Great.
Let's go ahead and get this blood pressure started.
Okay.
Okay, so what brings you in today?
Well, I experienced a bit of a slip and fall and I kind of hurt my back a little bit.
Okay, I'm sorry to hear about that. Did you hit your head or anything like that?
No, thankfully.
Okay, it's just your back that's hurting?
Yeah.
Okay, a couple more questions about COVID.
Okay.
Any travel outside the country in the past 30 days?
No, ma'am.
Any cough, fever, shortness of breath?
No.
Have you been in close contact with anyone that might have COVID?
No.
Okay, great. All right. Well, we'll get you back in just a few minutes and have the physician take a look at you.
Thank you so much.
You're welcome.
So you may get to have those same questions asked of you more than once when it comes to the COVID-19 questionnaire. But that's an added layer of protection for both you and for the people who are caring for you. It's all part of our promise to keep you safe. To make sure we're keeping you safe and reducing the risk of exposure to people who may be experiencing COVID-19 symptoms, we have transformed this area of our emergency room, called our Fast Track, into our COVID-19 area. These rooms have been specially prepared to care for patients who may be exhibiting symptoms of the virus. Now, for all other patients who are here for non-COVID emergencies, we still have ample room for you to receive care from our doctors and nurses here in our emergency department. So I've been showing you a lot of the extra steps we are taking to make sure that you are safe whenever you come through the doors of any AdventHealth facility, but especially here in our emergency department. And right now, I want to have a moment with our emergency room medical director, Dr. Byron Dixon, to talk about why we shouldn't put off the care we need.
Absolutely. I want to thank our community. You know, they've shown a tremendous amount of support and outreach to our frontline heroes. We are so blessed to live in such a supportive community, and our team is now more dedicated than ever to keeping our community safe.
But what about the people who might be watching this and saying they're just not sure and they might put off an emergency need?
Well, something such as, for instance, if you're having chest pain, shortness of breath, severe abdominal pain, those could be a sign of a serious medical condition, and you need to seek medical care immediately. If you delay your care, this could lead to a worsening condition or a worsening outcome. And so, you know, these things could be a sign of a heart attack, a stroke, and it's very important to seek medical care immediately.
Thank you, Dr. Dixon. We appreciate your time, and we know you're very busy here, so we'll let you get back to taking care of people.
Thank you.
All right. So there you have it. It's all the efforts that are being made to keep you safe. It's our promise to you, and you can count on it every time you come to AdventHealth for care.